We're pleased to welcome now Mari Caitlyne Blaylock, family nurse practitioner and mobile unit coordinator with Access Community Health Services. Mari, thanks for coming on.
Thank you for having me.
All right, so tell us exactly what your job entails there.
Like you said, I'm a family nurse practitioner with Access Family Health Services. We have 5 main clinics and 10 school-based clinics, and then we have our mobile unit, which is a mobile clinic on wheels, basically, that we've rolled out pretty much full-time in January of this year. We offer all of the services on our bus, our mobile clinic that we offer in our regular clinics. We can do acute care, sick visits, chronic care visits, wellness visits. We're able to do labs and swabs for sick visits, pretty much anything that you can get in our regular clinic. We offer to the community. We try to travel into rural areas and get health care out there to everybody.
So I just saw the vehicle out front, right?
Yes, that's us.
Brand new?
It is.
That's pretty cool.
Yes.
Yeah, I don't remember seeing that in the past. So how far will you travel with it?
We typically go, we cover around 5 counties, about 50 miles from our main clinic in Smithville is where we try to stay. And we also have a full working lab on there, triage. We are set up for dentistry. We hope to get that rolling pretty soon as well.
And what about physicians? Do they accompany you as well sometimes, or how do you get them involved?
I'm typically the only provider.
Okay.
We do have collaborating physicians at all of our clinics. Yeah. We're staffed of just me, a nurse, and our receptionist and a driver. And so we typically do community events. We go to some schools as well that we don't have school-based clinics in. Also, are trying to reach out to industries to promote wellness visits for insurance benefits. I know that that's a big need.
Sure.
So we try to do a broad scope.
How do you work with Sally Kate Winters?
This is our first time working with Sally Kate. We don't have any clinics in West Point, and so we are excited about coming to this area, and we're hoping to establish some permanent relationships with them to help them out in any way that we can to provide care for them.
And especially the children, right? Sometimes
yes.
Maybe they, because of their circumstances, have some ailments that haven't been addressed.
That's right. We see all ages, pediatrics to geriatrics. Again, do sick and wellness visits. We can offer vaccines as well. TB skin tests, I know that we've discussed that with them. So we hope that we have a lot of services that will benefit them in the future, for sure. And we accept insurance, but we also have a sliding fee program where it is based on income and household size. So we pretty much can offer care to anybody, insured or uninsured.
Do you see this as becoming a more mainstream approach to delivering health care?
Absolutely. We have already seen benefits as far as setting up in schools and industries, being able to keep students in the school, treat them, and send them back to class if that's possible, and then doing wellness visits to keep employees preventative measures and then keeping them at work as well and not having to take time off. So I think that it's really starting to take off for sure.
So will employers, companies call you guys in and come to site?
Yes, we have worked with a few municipalities, but we're really trying to form some relationships with companies because, again, we accept all insurances, so and have the sliding fee program as well. So we would love to go set up anywhere. We run off of a generator, so we're fully functioning without having to have anything other than somewhere to park.
Yeah, I mean completely mobile.
That's right.
Wow. Do you see the organization perhaps expanding to other areas of the state? Is that something that might be on the radar?
I hope so. Access is constantly growing. They started out as one clinic, and now we're up to 10. We
Wow.
also have a dentist office, 3 pharmacies. So we are constantly growing.
Do you feel like this approach, this mobile approach, could be a valuable tool in servicing the so-called healthcare deserts, particularly in our state, where they're just a long way away from needed care?
Yes, absolutely. Access is actually, that's what we do, is serve rural health. We started out as rural health providers, and so that's what we work towards for sure. And that's where our 340B program, pharmacy program, comes in, where people that don't have prescription coverage or have no health insurance can be seen on our slide fee and then use our pharmacies as well. So really nothing holding them back from getting the care that they need and deserve.
Absolutely. Mary, thanks for coming on.
Thank you
Appreciate
so
it.
much.
That's a wrap here today, folks. From West Point, Mississippi, Sally Kate Winters Family Services. Don't forget to text SuperTalk 25 to 91999 to donate to this fine organization. Back with you again tomorrow in the Element Weld studio at SuperTalk headquarters. Until then, stay safe and God bless everyone.